We now want to think about the systemic veins. Now these are the systems of the body here. This represents the body. So we have the systemic capillaries, the systemic venules draining into larger systemic veins, ultimately draining into the inferior and superior vena cava, which are going to drain into the right atrium. So what can possibly go wrong here? Well, we notice that there's a pressure of about 3 to 8 millimeters of mercury there in the central veins. And if someone loses a lot of blood, they will develop or indeed if they lose fluid of any sort, they're going to eventually become hypovolemic. Low volumes, hypovolemia in the blood. So for example, after hemorrhage, the blood volumes can drop. Or after burns patients can lose an awful lot of fluids. Or dehydration, possibly caused by diarrhea and vomiting, for example. Very common problem in children, because children have much lower blood volumes than adults. So diarrhea and vomiting, especially in young children, needs to be taken seriously, and we need to give them fluid replacement at an early stage, preferably with oral rehydration salts. But of course in healthcare we often give intravenous fluids. If you think about it, when we give intravenous fluids, those fluids are going into the systemic veins. The veins in the arm are systemic veins. And if we give too much, that can lead to fluid overload. Fluid overload, where there's too much fluid in the veins and we can get an increase in systemic venous pressure due to fluid overload. This is usually caused by something that we do wrong in healthcare, so it's what's called an iatrogenic disorder. Iatros is the Greek word for doctor, genic is to begin. So something literally that begins with the doctor. So make sure we give the right amount of intravenous fluids. Now another condition that we can get affecting the systemic veins is chronic venous insufficiency. Now I'm not going to deal with this in great detail because it's dealt with in other places, but you know that veins have valves in them to ensure the one-way flow of blood. The veins have valves, but basically if these valves fail, then the blood is going to dam back, forming a column of blood. And the pressure at the bottom of this column of blood is going to be higher than it should be, because instead of having little columns of blood in between the valves, we end up with one big one because the valves have failed. And that's going to lead to chronic venous insufficiency via the mechanism of chronic venous hypertension. So chronic venous insufficiency caused by chronic venous hypertension. Now this is normally affecting the veins in the legs, is the most common place. It can affect the arms as well, but the legs is the most common. And this gives us clinical features such as edema. And we get the brown staining. The hemosiderosis. But it can lead to venous ulcers, which are painful, and it can also lead to infection. In fact, venous congestion is painful anyway, especially after exercise, because the limb becomes over-engorged with blood. So, chronic venous insufficiency causing backlog of blood, particularly into the legs. But another common cause of systemic venous hypertension is right ventricular failure. So we need to think about right ventricular failure. RVF, the right ventricular failure. Now, we have noticed that right ventricular failure can develop secondary to lung disease. So if there's problems in the lungs where there's not enough oxygen in the alveoli, there's going to be a reflex pulmonary arterial vasoconstriction. It's going to close down. And if that happens, especially all over, if there's a vasoconstriction in the pulmonary vessels, the total lumen is reduced, making it harder for the blood to get through the reduced lumen. That's going to cause a backlog in pressure, meaning that the right ventricle has to work harder to pump the blood out. The right ventricle will compensate by enlarging. There'll be a right ventricular hypertrophy, and over time there'll be a right ventricular failure. And if the right ventricle can't work properly, then blood will be left in the right ventricle at the end of ventricular systole, damming blood back into the systems of the body. So right ventricular failure will lead to systemic edema. This is why in patients with chronic obstructive pulmonary disease, for example, they become blue and bloated. So they're blue because they're cyanosed, because the lungs aren't working properly, so they're not getting enough oxygen in, but they're also bloated because they're accumulating this fluid. This is why we need to give the long-term oxygen therapy. When we give long-term oxygen therapy, we increase the amount of oxygen in the lungs, and that limits the vasoconstriction, allowing vasodilation, reducing right ventricular workload. But the most common cause of right ventricular failure actually is that it's secondary to left ventricular failure. So if the left ventricle is not working properly for whatever reason, then the blood's not being pumped out of the left ventricle, so the blood is going to dam back into the lungs. And over time, that's going to make it harder. Because the blood's damming back into the lungs, that's going to make it harder for the right ventricle to pump blood into the lungs. So if the left ventricle is not working properly, the blood can't get from the left atrium to the left ventricle, it's harder to get out of the pulmonary veins, it's harder for the pulmonary veins to drain the lungs. That's going to increase the pressure in the lungs, meaning the right ventricle has to work harder, causing right ventricular hypertrophy and right ventricular failure over time. So it's important to realise that left ventricular failure can cause right ventricular failure. And indeed it will work the other way around. Right ventricular failure will lead to left ventricular failure. So often you get a combined heart failure. But still thinking about the right ventricular failure, when there's right ventricular failure, it's most commonly caused secondary to left ventricular failure or lung disease, as we've said. But it can also be caused, right ventricular failure can be caused by failure of the tricuspid valve or the pulmonary artery valve. Because if the one-way flow of blood through the body is not ensured, there can be regurgitation of blood, meaning the blood can't get from the systemic veins into the right atrium. So these patients are often very tired and they're often breathless. They get tired because the blood's not circulating, the blood's not clearing from the body properly, so there's going to be congestion in the body. This is why we call it congestive cardiac failure, because there's congestion. And very often these patients, as we've said, are distended. They can be nauseated because of the accumulation of fluid. And because the blood's not draining from the top half of the body, there can be raised jugular vein pressure, jugular venous distension. But can you see the blood's not draining properly from anywhere? So it's not draining properly from the liver, for example. So the liver isn't draining properly. And that can cause enlargement of the liver. This is a cause of hepatomegaly. And the liver can be tender because the capsule round about the liver gets stretched. But the enlargement in the liver tends to be smooth enlargement of the liver. And you can even get free fluid accumulating in the abdominal cavity. So quite a lot of features we can look for that indicate the presence of right ventricular failure. But as we've said, right ventricular failure over time will lead to left ventricular failure. Just the same as left ventricular failure over time will lead to right ventricular failure. So that's just a few things that can go wrong with the systemic veins. Hypovolemia, fluid overload, the disease of the valves affecting the veins, or disease of the right ventricle. It's maybe just worth mentioning that if the disease is localized, for example, if it's a disease of the valves in one leg, there can be swelling in one leg but not the other. But with these systemic conditions, such as right ventricular failure, the clinical features are more likely to be bilateral. They'll affect all the systems of the body, but there's probably going to be swelling, probably equally in both legs. So consider more localized causes, but consider systemic causes.